This week marks 3 years since the Supreme Court struck down Roe v. Wade. While the Dobbs decision marked an enormous victory for the pro-life movement, recent research shows the number of abortions is rising. Medical reporter Lori Johnson explains why.
The Dobbs decision gave individual states the right to regulate abortion. Half enacted some type of ban, which at first led to fewer abortions. Now, however, they're on the rise, largely because abortion pills are being mailed pretty much anywhere.
I think some people might have thought that the Dobbs decision was the end of the story, and we wish that were the case. The challenges ahead of us are great, even as we celebrate 3 years of the Dobbs decision.
A new report shows there were about 95,000 abortions a month nationwide last year. That's up from 88,000 a month in 2023. The so-called abortion pill is used about 70% of the time.
Well, one of the deep ironies that has taken place since Dobbs is that medication abortion care is actually more accessible today in many states with bans than it was prior to Dobbs.
These days, abortion pills are mailed from places in states where it's legal, like this one in Massachusetts, to individuals in states like Texas where it isn't. The pill providers feel protected by newly enacted shield laws.
So if a clinician is licensed in Massachusetts, resides in Massachusetts, and practices from Massachusetts, for the purposes of telemedicine medication abortion care, that care is now considered to be taking place in Massachusetts, regardless of where the patient is located.
At least one shield law is already being challenged. Plaintiffs in Texas and Louisiana are suing a doctor in New York, where abortion is legal, for sending the pills to women in their states which have bans.
It's the law of Louisiana. Governor Landry, Attorney General Liz Murrow, and our legislature has seen fit that abortions are illegal in this state.
Currently, 18 states have shield laws.
We go back to what the Dobbs decision permitted, and it was allowing the states to do what they want, allow the issue to come back to the people. So if the people of Louisiana or people of Texas want to protect unborn lives, they should be permitted to do so in a meaningful way to enforce those laws.
Experts predict the legality of shield laws will ultimately be decided by the U.S. Supreme Court, Andrew. It's turning into a battle between the states. You have some saying our doctors should be able to prescribe abortion pills to people in other states where there are bans. And then you have those states saying, no, doctors in other states should obey our laws when prescribing to our citizens.
Lori, you talked about the pills. How easy is it to get abortion pills in the mail?
Very easy and very fast. It's usually done completely online. The patient answers a few questions, signs a consent, and the pills are sent to her home, dorm room, P.O. box, usually within a week.
Wow. All right, let's talk about the dangers. It's something we're not really hearing being reported on. How dangerous is it to have an abortion in this manner?
With these abortion pills, well, new research shows 11% of women who take these abortion pills do experience serious health complications. Obviously, many of them end up in the emergency room. We're talking about things like infection, hemorrhaging, severe bleeding. But here's the deception, Andrew. Abortion proponents are making it very clear to women who take these abortion pills that if you go to the ER, you do not have to tell the doctor you took an abortion pill. You can say you're having a miscarriage and no one will know the difference. So what's happening is these doctors are coding, they're putting in the insurance claims and on their records that these patients are having miscarriages when in fact they're suffering from botched abortions.
All right, let's talk about President Trump. He's got the big, beautiful bill. It's still making its way through Congress. Why are pro-life advocates watching this so closely?
Well, because the House already passed its version, and in it, it excludes abortion providers like Planned Parenthood from participating in Medicaid, so no tax dollars for abortions. The Senate has it now. It looks like they're going to keep that provision in there. They will likely pass it with even as early as this week. The president says he wants it on his desk by 4th of July.
All right, Lori, it's a story I wish you did not have to report on, but we thank you for bringing it to our attention.
Thanks for having me.